Sir, put your hands where I can see them now. Security guard Ronan Blaine's hand hovered over his taser, fingers trembling with adrenaline. The black man standing in the ER entrance didn't move. Blood splattered across his shirt, hands steady at his sides, dark eyes scanning the chaos with unnerving calm. When I said, hands up, you don't belong here. Dr. Kaden Voss had saved 3 lives. What happened next would expose years of systematic racism hiding behind hospital protocols. Have you ever been so misjudged that people couldn't see past their own prejudices? What you're about to witness will shake you to your core. The automatic doors of Monroe Medical Center's emergency room burst open with mechanical precision. What entered wasn't what anyone expected. Kaden Voss stepped through the threshold, and the entire ER seemed a freeze frame. Blood covered his shirt, not his own. His expensive wool blazer hung torn at the shoulder. His hands, steady as a surgeon should be, were stained crimson. Nurse Supervisor Serena Hale looked up from her station, and her face went pale, not with concern, with fear. Security. Her voice cracked across the crowded waiting room. Security to ER entrance. Code gray. Code gray. Violent person with potential weapon. Kaden's eyes tracked the room with clinical precision. Patients in various states of distress, nurses at stations, doctors visible through exam room windows. And now 2 security guards converging on him with hands on their weapons. Sir. Security guard Ronan Blaine approached, his partner Declan Riley flanking from the right. I need you to put your hands where I can see them right now. Kaden's hands remained at his sides. When he spoke, his voice carried the calm authority of someone who'd commanded operating rooms. I'm a physician. I didn't ask what you were. Blaine cut him off sharply. Hands up now. In the waiting room, phones began emerging from pockets. The universal reflex of witnessing something that might go viral. A young black woman named Jasmine Washington, waiting for her grandmother's X-ray results, opened her phone and started recording. Her live stream counter hit viewers in seconds. But what nobody in that ER knew yet would change everything about what they were witnessing. Kaden slowly raised his hands, palms forward, blood still wet on his fingers, caught the harsh fluorescent lights. There was an accident, Kaden said calmly. Multiple vehicle collision. I stopped to help. Yeah, sure you did. Blaine's voice dripped with sarcasm. And I suppose all that blood is from your Good Samaritan work. Serena Hale had moved from behind her station now, maintaining a safe distance but close enough to add her authority to the situation. Sir, we have protocols here. You can't just walk into an ER covered in blood without proper identification or explanation. I just gave you an explanation. Kaden's tone remained level, but something flickered in his eyes, something that made Jasmine zoom in with her phone camera. Riley, the second security guard, had circled behind Kaden, standard tactical positioning for a potential threat. His hand rested on his radio. Dispatch, this is ER security. We have a code gray situation. Male subject, African American, blood on clothing, potentially violent, requesting backup. Jasmine's live stream exploded. Comments flooded in faster than she could read them. They profiling him right now. Why are they treating him like a criminal? This is at Monroe Medical Center in Atlanta. Someone record this. Her viewer count hit. The blood on Kaden's hands was still warm. The lives he just saved were still breathing. But what this security guard was about to do next would ignite a firestorm. I'm going to need you to get on the ground. Blaine unclipped his taser, face down, hands behind your back. Kaden didn't move. His jaw tightened almost imperceptibly. Officer, that's not necessary. If you'll allow me to show you my identification. Did I say you could reach for anything? Blaine's voice rose sharply. Keep your hands visible. A doctor emerged from exam room 3. Dr. Nadia Foster, a white woman who'd been with Monroe Medical, took in the scene. The bloody black man, the aggressive security posture, the phones recording, and made her assessment in seconds. "What's going on here?" She directed the question to Blaine, not Kaden. "This man walked into the ER covered in blood. Won't comply with security protocols." Dr. Foster looked at Kaden for the first time. Really looked. Her eyes moved from his blood-stained hands to his torn but clearly expensive clothing to the watch on his wrist, a Patek Philippe that cost more than most cars, to the calm, almost clinical way he stood despite being surrounded. Something in her expression shifted. "Sir?" she said to Kaden, her tone markedly different from the security guards. "Are you injured? Do you need medical attention?" "I'm fine, but there are others who need help. The accident scene." "We've already dispatched ambulances," Riley interrupted. "Got the call. MVA on Peachtree with multiple casualties." Caden's eyes sharpened. "Then you know it's real?" "I was first on scene. I'm a surgeon. I stabilized 3 patients before EMTs arrived." Blaine scoffed. "Right, and I'm the Surgeon General. Face down now, last warning." That's when Caden's phone started ringing. The ringtone, Brahms' lullaby, echoed through the tense ER. What the caller was about to say would shatter every assumption in that room. "Yeah, I don't even think about answering that." Blaine stepped closer, his taser now fully drawn. The phone continued ringing. Caden's eyes never left Blaine's face. "That's my chief of staff calling. She's likely wondering where I am for the board meeting." Serena Hale frowned. "Chief of staff, sir, I don't know what game you're playing." "Dr. Voss." A voice cut through the tension like a scalpel through flesh. Everyone turned. Dr. Tariq Chen, head of emergency medicine, stood frozen in the doorway from the staff corridor. His face had gone ashen. "Dr. Chen." Caden's greeting was mild, almost pleasant. "Good evening." Chen looked from Kaden to the security guards with their weapons drawn to the gathering crowd of patients and staff, to the phones recording everything. "Oh God, oh my God." Chen's words came out barely above a whisper. He turned to Blaine and Riley. "Do you know who that is?" Blaine's confidence wavered for the first time. "Some guy who walked in covered in blood?" "That's Dr. Kaden Voss." Chen's voice was shaking now. "He's the founder and CEO of Monroe Medical Center. This is his hospital. All 8 Monroe hospitals across Georgia. You just pulled a taser on the man who signs your paychecks." The silence that crashed over the ER was absolute, but the revelation was just beginning. What Jasmine's live stream was about to capture would become the most watched medical discrimination case in history. Jasmine's viewer count had exploded. Comments flooded in so fast they blurred together. "The CEO? OMG, they really did that to their own boss? This is insane." Screen record everything. Blaine's face had gone pale. The taser slowly lowered but didn't holster. His partner Riley looked like he might actually pass out. Serena Hale gripped the edge of her nurse's station. "Dr. Voss, sir, we had no way of knowing." "Didn't you?" Caden's voice was soft, dangerous. "I walked into this ER, my ER. Explained I'd been helping at an accident scene, and your immediate response was code gray. Violent threat." He looked at Blaine. "You ordered me to the ground, threatened me with a taser, told me I didn't belong here." "Sir, I was just following protocol." "What protocol?" Caden's calm fractured slightly. "The protocol that assumes a black man covered in blood must be violent, must be dangerous, must be lying." Dr. Chen stepped forward, hands raised in a placating gesture. "Dr. Voss, please. I'm sure this was just a misunderstanding. James, Caden's use of Chen's first name carried weight. How many times have you walked into this ER after a messy procedure without being threatened with a weapon? Chen couldn't answer. How many white doctors have been ordered to the ground by security in our facilities? Silence. Jasmine's phone buzzed with a notification. Local news networks were already reaching out, but what Dr. Voss revealed next would turn a viral moment into a national conversation about healthcare racism. Kaden pulled out his phone, moving slowly, deliberately, so Blaine wouldn't make another mistake, and opened an app. He held the screen up so everyone could see. This is the Monroe Medical Center internal security system. Real-time monitoring. He scrolled through camera feeds. People have entered this ER with visible blood on their clothing. We're white. We're black. He looked directly at Serena Hale. How many code grays were called? Hale couldn't hold his gaze. All black patients, 0 white patients. Kaden answered his own question. Despite white patients having significantly more blood visible than I do right now, he turned the screen toward the watching crowd. Several people gasped audibly. This isn't new. I've been documenting systematic bias in emergency response protocols, different hospitals, same patterns. Tonight, I became the final data point in my own study. Dr. Nadia Foster, who tried to de-escalate earlier, spoke up. Dr. Voss, with all respect, wouldn't it be standard procedure to approach any unknown person with blood on them with caution? Dr. Foster, excellent question. Kaden pulled up another screen. This shows the security response protocol I personally approve for this facility, page 7, section 4C. When encountering individuals with biological contamination, security will maintain safe distance, request identification, and call medical staff to assess for injury before initiating restraint protocols. He looked at Blaine. You bypassed all 3 steps. You went straight to weapon drawn and restraint orders. Why? Blaine's mouth opened and closed. No words came out. I'll tell you why. Caden's voice carried to every corner of the ER. Because you saw a black man, and your brain registered threat before potential patient, before possible physician, before human being who might need help. Jasmine's live stream had reached viewers. Major news outlets were now in the comments asking permission to broadcast, but what Dr. Voss did next would revolutionize hospital discrimination protocols nationwide. Kaden walked toward the nurse's station slowly, hands visible, because he understood that his safety still depended on not startling anyone. He pressed his thumb to the biometric scanner that authorized access to the administrative system. The screen lit up with administrative controls that made several staff members gasp. As of this moment, Kaden announced, his voice carrying the weight of absolute authority, I am initiating a Code Silver for this facility. Dr. Chen's eyes widened. Code Silver meant immediate executive oversight and potential disciplinary review. Security guards Blaine and Riley. You are suspended effective immediately, pending full investigation. Dr. Chen, you'll oversee their temporary replacements. Both guards looked like they might argue, then thought better of it. Nurse Supervisor Hale, you're suspended from supervisory duties pending retraining on bias recognition and de-escalation protocols. Hale grabbed the edge of her desk. Dr. Voss, please, I have children. I can't afford... Your pay continues during suspension. This isn't about punishment. It's about correction. Caden's voice softened slightly. But Serena, you called a code gray on someone who told you he was a physician helping at an accident. You didn't ask for ID. You didn't assess for injuries. You assumed threat. He addressed the entire ER. Everyone present during this incident will participate in mandatory implicit bias training starting tomorrow. This includes physicians, nurses, security, and administrative staff. But Dr. Voss wasn't finished. What he revealed about the accident scene would shift the entire narrative from his discrimination to a much larger systemic problem. Now, Kaden continued, his clinical tone returning. Regarding the MVA on Peachtree, 3 patients en route via ambulance. I need a trauma bay prepped immediately. He rattled off medical details with machine-like precision. Patient 1, male, crushed chest cavity, pneumothorax. I decompressed at scene, but needs chest tube immediately upon arrival. Patient 2, female, severed femoral artery. I applied tourniquet. She has time before we risk irreversible tissue damage. Patient 3, pediatric, closed head trauma, pupils unequal. Wait, Dr. Foster interrupted. You performed a needle decompression at an accident scene without equipment? I used a pen. Kaden's response was matter of fact. The man was dying. I didn't have time to wait for an ambulance. The tourniquet on the femoral artery, how did you... I used my belt and a tire iron as a windlass. Again, the woman was bleeding out. Kaden checked his watch, the Patek Philippe that Blaine had probably assumed was fake. As if on cue, the distant wail of ambulance sirens began growing louder. Jasmine's live stream exploded with comments. He saved 3 people, and they treated him like a criminal. This is what systemic racism looks like. Someone better screen record all of this. Her viewer count hit. The ambulance bay doors burst open. EMT Valeria Martinez wheeled in the first gurney, calling out vitals. Behind her, 2 more ambulances discharged the other patients Kaden had stabilized. Dr. Chen and Dr. Foster immediately began coordinating the trauma response, but Martinez stopped when she saw Kaden. Dr. Voss, thank God. The guy with the crushed chest is asking for you. He wants to thank the man who saved his life. Every eye in the ER turned to Kaden, the violent threat, the suspicious person who didn't belong. Jasmine hit the share button on her live stream. It would have shares, but the real transformation was about to begin. The patient on the first gurney, a white man, was conscious despite his injuries. When he saw Kaden, his eyes filled with tears. You, he gasped. You're the doctor. You saved us, all of us. Kaden moved to his bedside with the fluid competence of a surgeon who'd spent years in trauma situations. Try not to talk. You have broken ribs. We're going to get you into surgery. No, wait. The man gripped Kaden's hand with surprising strength. My daughter, the little girl in the back seat, is she... Patient 3, Kaden confirmed. She's here. She's alive. Dr. Chen is the best pediatric trauma specialist in Georgia. She's in excellent hands. The man sobbed with relief. I saw what they did to you in the parking lot. Heard the security guard. You saved my daughter's life, and they treated you like... It's okay. Kaden's voice was gentle. Rest now. But the man wouldn't let go of his hand. It's not okay. Nothing about this is okay. Dr. Foster had heard the exchange. She stood frozen, staring at Kaden with something between admiration and horror at her own earlier uncertainty. The second patient arrived. The woman with the femoral artery injury. EMT Rodriguez gave the handoff report. Patient's name is Harlow Cole. Estimated blood loss 1,600 cubic centimeters. Pressure's dropping. Or 2 now, Dr. Chen ordered. Vascular surgery team standing by. As they wheeled Harlow past, she reached out weakly toward Kaden. The man who helped me. Is he here? I'm here, Kaden confirmed, walking alongside her gurney. They said you're a doctor. Thank you. Thank you for not driving past. Her voice was fading from blood loss, but her eyes were clear. So many cars just drove past. The third gurney carried the girl, still unconscious but stable. Her father tried to follow, but nurses held him back for his own treatment. Sir, we need to treat your injuries. That's my daughter. He fought weakly against the restraints of his own gurney. Please, I need to know she's okay. Kaden stepped in. Mister, she has a concussion and possible skull fracture, but her vitals are strong. She was wearing her seatbelt, which likely saved her life. Dr. Chen will update you the moment we have more information. Barrett's eyes fixed on Kaden. You were the one, the man who pulled her out. I remember now. You reached through the broken window. I did. And then I heard sirens and I passed out. Barrett's face suddenly changed as memory returned. I heard security guards. They were yelling at you, threatening you. Oh my God. The ER had gone completely silent, except for the beeping of monitors and the soft whoosh of ventilators. Barrett Davidson, a white man whose daughter lay in trauma bay, 3 because of Kaden's intervention, looked at the security guards who'd drawn weapons on his daughter's savior. You threatened to tase him? Barrett's voice rose despite his injuries. The man who saved my daughter's life? The transformation began. Ronan Blaine stood in the corner of the ER, still holding his taser, watching his career disintegrate in real time. Declan Riley had tears running down his face. Serena Hale sat at her station with her head in her hands. Kaden Voss stood in the center of it all, blood still on his hands, watching the trauma he'd witnessed being treated with the full resources of modern medicine. Dr. Voss. Dr. Nadia Foster approached cautiously. Sir, I want to apologize. I didn't immediately defend you. I should have. I saw what was happening and I asked the wrong questions. Kaden studied her. Dr. Foster, you actually tried to de-escalate. You asked if I needed medical attention. You treated me like a potential patient, not a guaranteed threat. That's more than others did. But I didn't do enough. I saw the guards with weapons drawn and I didn't call them out. And tomorrow you'll begin the training that will help you understand why that silence was dangerous. But Nadia, he used her first name. You're one of the best emergency physicians I've recruited. This moment doesn't define your career unless you let it. Dr. Foster nodded, blinking back tears. Dr. Tariq Chen approached next. Sir, I need to say something. I saw you when I came in, and my first thought wasn't, why is Dr. Voss covered in blood? It was, I need to save my security team from making this worse. I assumed you were in the right, but I still saw you as the CEO who needed to be appeased, not as a colleague who might need support. Kaden considered this. Tariq, you've been my head of emergency medicine. In that time, how many discrimination complaints have crossed your desk? Chen's face fell. Sir, complaints, all from black patients or black staff members. Your response rate? You personally addressed some of them. The others were forwarded to HR and disappeared into bureaucratic processing. The accusation hung in the air like smoke. I thought I was following protocol, Chen said weakly. You were. That's the problem. Our protocols are designed to minimize institutional liability, not to address institutional racism. The Georgia Medical Board conference room was packed with representatives from every major hospital system in the Southeast. Dr. Kaden Voss stood at the podium. His presentation titled, The Emergency Room Bias Protocol, a Case Study in Institutional Racism. On the screen behind him, security footage played. Himself covered in blood entering his own ER, the weapons drawn, the assumptions made. This is me, he narrated calmly. Founder and CEO of Monroe Medical Center, fellowship-trained neurosurgeon, peer-reviewed publications, years of medical practice. The footage showed Blaine pulling his taser. This is also me being treated as a violent threat in my own facility because security protocols failed to account for implicit racial bias. He clicked to the next slide. Statistical analysis showing the disparity in code gray calls. In the months following this incident, Monroe Medical Center implemented comprehensive anti-bias protocols. We've had 0 discriminatory security responses. 0. Patient satisfaction among Black patients has increased. Staff retention among Black employees is up. Another slide. We're not perfect. We had our first bias complaint in months. A Black physician was asked to show credentials in an area where white physicians move freely. The difference? We now have a response protocol. The complaint was filed. By the end of the day, the staff member responsible was in retraining. By evening, I personally called the physician to apologize and discuss policy improvements. A hand raised in the audience. Dr. Margaret Stevens from Emory University Hospital. Dr. Voss, what were the consequences for the security guards in your case? Guard Blaine was terminated after investigation revealed a pattern of disproportionate use of force against Black patients. Guard Riley completed extensive retraining and now serves on our bias intervention team, using his experience to train others. His most powerful teaching tool is his own mistake. Another question. What about the nurse supervisor? Serena Hale completed months of supervised practice with weekly bias counseling. She's now one of our strongest advocates for protocol reform. She identified and corrected a bias pattern in triage wait times that our data team had missed. The presentation continued. Statistical evidence from 8 Monroe medical facilities. The cost-benefit analysis of bias training versus discrimination lawsuits. The measurable improvements in patient outcomes when care providers address their own prejudices. But Kaden's final slide wasn't about statistics. It was a photo. Barrett Davidson and his daughter Lila, recovered and healthy. Harlow Cole, the woman with the femoral artery injury, now training to become an EMT. And the man with the crushed chest, Kian Chen, who'd started a nonprofit teaching bystander emergency response. These 3 people are alive because I stopped at an accident scene and used my medical training to save them. I'm standing here today because Jasmine Washington, a young Black woman in my ER waiting room, decided to live stream what she witnessed. She saw injustice and documented it. He paused, looking out at the sea of medical professionals. How many Black doctors have walked into your ERs and been treated as threats? How many Black patients have received substandard care because implicit bias affected clinical judgment? How many more Jasmine Washingtons will need to document our failures before we commit to systemic change? The room was silent. The Monroe Protocol is available free to any healthcare facility in the country. It's not perfect. We're still learning, but it's a start. He advanced to his final slide. Contact information and a QR code linking to comprehensive training materials. The question isn't whether bias exists in healthcare. The question is what we're going to do about it. Jasmine Washington sat in the audience, now a healthcare administration major at Emory University with a full scholarship from the Monroe Foundation. Her viral live stream had been viewed millions of times. She'd been interviewed by CNN, NPR, and the New York Times. But her proudest moment was watching Dr. Voss transform his personal discrimination into institutional change. She documented injustice. He'd weaponized it into justice. Her phone buzzed. A news alert. Monroe Medical Center ranked 1 in patient satisfaction and 1 in diversity metrics among Georgia hospitals. Jasmine smiled and opened her own notes. Her senior thesis was titled, From Viral Moment to Systemic Change, How Documentation Drives Healthcare Reform. She'd learned something that night in the ER that she wanted every activist to know. Sometimes the most powerful weapon against injustice isn't rage, it's evidence. And the most lasting victories aren't personal, they're institutional. On stage, Dr. Voss concluded his presentation. Change is possible, but it requires us to see our own bias, acknowledge our complicity, and commit to doing better. Not just for ourselves, but for every patient who walks through our doors, trusting us with their life. The standing ovation lasted. Justice, it turned out, wasn't just about one man being vindicated. It was about transforming an entire system so that vindication became unnecessary. After the incident, the Monroe Protocol had been adopted by hospitals across states. The American Medical Association added implicit bias training to their continuing education requirements. 3 medical schools revamped their entire ethics curriculum based on Dr. Voss's case study. Ronan Blaine, the security guard, started a YouTube channel documenting his journey from bias to awareness. His most watched video, "I drew a weapon on my boss. What I learned about my own racism," had millions of views and had been used in police training programs. Serena Hale published a paper in the Journal of Emergency Nursing titled "From Complicity to Advocacy: A Nurse's Journey." She now traveled the country training healthcare workers on bias recognition. Dr. Tariq Chen spearheaded a research initiative tracking discrimination patterns in emergency medicine. His preliminary data collected from hospitals revealed systematic disparities that would take years to address. But the work had begun. Barrett Davidson and his daughter Lila attended every Monroe Foundation fundraiser. Lila wanted to be a surgeon. Dr. Voss had promised her a mentorship when she was old enough. Harlow Cole completed her EMT training and worked for the same ambulance company that had responded to her own accident. She carried a photo in her pocket, herself, recovered and healthy, shaking hands with Dr. Voss at her graduation ceremony. And Jasmine Washington graduated summa cum laude, was accepted to Johns Hopkins School of Public Health, and planned to dedicate her career to healthcare equity. Her viral live stream was now archived in the Library of Congress as a significant civil rights document. Dr. Kaden Voss returned to doing what he loved most, surgery. But now, every time he walked into his own emergency room, he saw the changes. Security guards trained in de-escalation, nurses who questioned their own assumptions, protocols that prioritized humanity over procedural efficiency. The blood on his hands that night had washed off. The stain on the healthcare system was taking longer to remove, but it was happening. Sometimes justice arrives in an emergency room covered in someone else's blood, carrying the weight of systematic change in its skilled surgeon's hands. Sometimes the cure for institutional racism looks like a black doctor being brave enough to become the final data point in his own research study. And sometimes, just sometimes, the system actually learns